Hey, Innisfil, it's your mayor here with an update on Wednesday, May the 20th. So this morning was our monthly board of directors call for the Simcoe Muskoka District Health Unit. I sit on that board representing the county of Simcoe, but there's also representatives from the city of Barrie, from Muskoka, and also members that are appointed by the Minister of Health from the general public. So it crossed my mind that we've been talking a lot about the medical officer of health and that you might not be aware of all of the duties and responsibilities that this office has. And their main objective is to promote healthy lifestyles and prevent diseases. So if they're doing their job, it's kind of hard to measure how successful they are because an ounce of prevention is worth a pound of cure, right? So they have a number of responsibilities, number one being education, teaching prenatal classes, healthy baby classes, breastfeeding classes. They do food handling classes, safe food handling, and I'm sure there's many more that I'm not thinking of. Also inspections, they inspect restaurants, they inspect beaches and public pools, they inspect hair salons and nail salons. They also inspect small drinking water systems. I know any of you with a well has probably had your well tested by the health unit. So they have a wide range of things they look after. Immunization and vaccines is all part of their mandate as well. And I'm sure this is just the tip of the iceberg and I'm forgetting some very important pieces. Healthy lifestyle promotion, things like smoking cessation and providing guidance on exercise, how to watch out for ticks when you're going for a walk in the woods. All of these things fall under their purview. But I think most of that kind of flies under the radar until we have a global pandemic, at which point we rely so heavily on our health unit. They are doing all of the testing, goes through them. And then everyone who tests positive, they have somebody tracking where they've been, all their contact information, everybody they've been in contact with to help control that from spreading any further. And they've done the modeling through epidemiologists. And one of the things that Dr. Gardner shared with us today that I was quite proud of is the fact that by following the rules that he's given us, the physical distancing, coughing into your sleeve, staying 6 feet away from people and not being gathering in crowds over 5, that we here in Simcoe Muskoka have saved 500 lives. So that is a great news story, but that doesn't mean that we can now be complacent. It means that what we're doing is working and we have to keep doing it because we have to keep saving lives. If not your life, it could be the life of a healthcare worker. It could be the life of your grandmother. So please keep doing all those important things and let's keep Innisfil with low numbers. We have 30 cases right now in Innisfil, no one in the hospital at the moment, which is wonderful. We do have larger case numbers, both are all around us. So we have to be vigilant and remain vigilant and assume that anyone that we come in contact with could be symptomatic or asymptomatic, but still contagious. So a big shout out and a thank you, a well-deserved thank you to all of the folks at the health unit who are doing double duty right now. Really appreciate giving us all of our expert advice and helping us make informed decisions. Both us and the Premier and the Prime Minister, all levels of government are using their health experts to make the best decisions possible for the safety of our residents. So a little bit about what the health unit does, and stay safe and stay vigilant, and we'll talk tomorrow.